nurse today. I'm going to close the curtain. I'm going to perform hand hygiene. What I'm doing today is I'm going to perform a head-to-toe assessment. So what is your name and date of birth?
Hannah Woods, 10/27/98.
How old are you?
I'm 21.
Okay, I'm going to check your wristband. Alright. Well, you are dressed appropriately for the weather. Your posture is good. Your body's properly aligned. There's no signs of distress. You look clean and neat. What kind of mood are you in today?
I'm happy.
Okay. You're alert and oriented ×4. Your speech is precise and clear. Could you stand up for me and take a few steps to the end of the bed, heel to toe? Okay. You have a steady gait. You can go ahead and sit down for me. All right. So now I'm going to be performing vital signs on you. All right, I'm going to start with your blood pressure. Okay. Take your temperature while we're doing that. Blood pressure is 122/80. Your temperature is 97.6. I'm going to assess your pulses and your breathing rate at the same time. Pulse is 77. You have 14 breaths per minute. I'm going to be assessing your skin. It is pink in color. It's warm and dry to touch. Okay, it feels soft. I'm going to test your skin turgor. Skin rebounds less than 1 second. Now I'm going to inspect your scalp. Hair is brown. It is thick and evenly distributed. There are no lesions or abrasions on the scalp. Okay, I'm going to look at your nails. Your nails look nice and clean. They are round in shape and contour. Her nail bed angle is 160. I'm going to be inspecting your head and neck. Your head is round in shape. Your face is symmetrical. Your scalp is free of any lesions or abrasions. Can you look to the right for me? Can you look to the left? Can you look up? Can you look down? Okay, your head moves smoothly. You have full range of motion. Okay, now I'm going to be checking for any masses. You have no masses. Your facial structures are symmetrical. I'm now going to palpate your frontal sinus. Do you feel any tenderness?
No.
Okay, now I'm doing your maxillary sinus. Do you have any tenderness there?
No.
Okay, now I'm going to test your TMJ. So just open and close your jaw. Okay, no clicks, move smoothly. Now I'm going to test your goiter. So can you just swallow that for me? Okay, no obvious goiter, and your trachea is midline. Be inspecting your eyes, so you'll just look straight forward for me. I'm checking your corneal light reflex. Okay, both pupils reacted. Your pupils are equally round and reactive to light accommodation. I'm going to check your sclera. Sclera is white. I'm going to ask you to take your glasses off, and then I'm going to check for your conjunctiva. Conjunctiva is pink and moist. Okay, now I'm going to test your vision with the Snellen chart. So you'll stand at the foot of the bed, 20 feet away. So cover your right eye and read the last line on the Snellen chart. FDPLCE now cover your left eye. Do the same.
FDPLCTEO.
Okay, now your vision is 2013. All right, now I'm going to assess your hearing, so I'm going to perform a whisper test. I need you to repeat after me.
Blue. Black. Red. White.
Okay, now I'm going to inspect the exterior auditory canal. Okay, your ears, the outside of your ears are free of lesions. There is no drainage. I'm going to look in your ear. For an adult, it's going to be up and back. Your tympanic membrane is pearly gray. The cone of light is at 5 o'clock. Up and back. Your tympanic membrane is pearly gray, and the cone of light is at 5 o'clock. I'm now going to assess your nose. First, I'm going to look in the mucosa, your nose. It is pink and moist, has no drainage, is symmetrical. Now I'm going to test the patency of your nose. So if you could just breathe out for me. Breathe out for me. Each nostril is patent. Did you feel any tenderness? All right. Now I'm going to assess your mouth. Your lips are pink and full in size. They're symmetrical on the face. Can you open your mouth for me? Okay. Your mouth mucosa is pink and moist. Your teeth are intact. You have your tonsils still. Your uvula is midline. Your tongue is pink and moist. It is also midline. I'm now going to assess your upper extremities. So your general appearance looks good. You're dressed appropriately for the weather. Your skin is pink in color. It is warm to touch. It is dry. Now I'm going to assess your temporal pulse. Temporal pulse is 2+. I'm going to check your carotid pulse, unilateral. +2. +2. Now I'm going to check your radial pulses. Radial pulse is +2. Now I'm going to check your capillary refill in each hand. Capillary refill is less than 3 seconds in both hands. I'm just going to look at your nail beds. Your nail angle is 160. Now I'm going to check your lower extremities. So I'm just going to take your shoe off for you. Okay, your skin is pink in color, it's warm to touch, it's dry. I'm now going to listen to your dorsalis pedis pulses. +2. Going to check your capillary refill. Less than 3 seconds. Now I'm going to check you for edema. No edema noted. Your nail beds are... I'm now going to listen to your heart sound, so I'm going to auscultate with my stethoscope. If you could, will you please just raise your shirt up for me? Okay, I am listening at the aortic for your heart sound. I hear S1 and S2 heart sounds. There are no murmurs, no pitches, so that's good. Now I'm going to name the landmarks. Aortic, pulmonic, Erb's point, tricuspid, mitral. I'm now going to be inspecting your chest. Your Your chest is nice and contoured. You have unlabored breathing. Your posture is good. You are upright. If you could you please stand up and turn around for me? Okay. So the posterior of your chest is symmetrical. Okay, now I'm going to test for tenderness and tactile firmness. So just say 99 when I touch you.
99, 99, 99.
Okay, now I'm going to percuss. Okay, it is tympanic sounds. Now I'm going to auscultate your lungs. 1, 1, 2, 2, 3, 3, 4, 4. Okay, your lung sounds are vascular. Now I'm going to test your chest excursion. 1 deep breath for me. Okay, chest expands equally and bilaterally. I'm now testing your anterior thorax. Okay, so I'm watching your respirations. They are unlabored. Okay, it is about 16 breaths per minute. Now I'm going to auscultate the lungs. 1, 1, 2, 2, 3, 3. Okay, it is bronchial vascular sounds. Now I'm going to percuss. All tympanic. Now I'm going to test for tactile firmness. Just say 99 when I touch.
99, 99, 99.
Okay, was there any tenderness?
No.
Okay. I'm going to be assessing your abdomen. Could you lay down for me and just pull your shirt up? Okay, your abdomen is contoured. It is round in shape. It is symmetrical and there are no pulsations. Now I'm going to auscultate your bowel sounds. Right lower, right upper, left lower. Her bowel sounds are normoactive. They're not hypoactive, which will be slower bowel sounds. They're not hyperactive, which will be fast and more. Now I'm going to percuss. Sounds are all tympanic in all 4 quadrants. Now I'm going to lightly palpate for tenderness. Did you feel any tenderness in any quadrants? Okay, and if I were to deeply palpate, then I would do it harder. There are no pulsation. Okay, now I'm going to be assessing your musculoskeletal system. Could you stand up straight for me? Your body is properly aligned. Your extremities are symmetrically on the body. Now I'm going to be performing range of motion on myself. I'm going to do the fingers, extension, flexion, wrist, flexion, extension, elbows, flexion, extension, shoulder, flexion, extension, neck, flexion, extension, spine, flexion, extension, hips, flexion, extension, knees, flexion, extension, ankles, flexion, extension. Now I'm going to do my toes, flexion, extension. I'm going to be testing your muscle strength, so I'm going to start with the trapezius. Please just lift up your shoulders against my hands. Okay, that would be a 5 out of 5. Now I'm going to test your biceps, so just do your arms like this and pull. Okay, that's a 5 out of 5. Now push on my hands for your triceps. 5 out of 5. I'm now going to be assessing the neurological system. I'm going to now name the 12 cranial nerves. 1 is olfactory, 2 is optic, 3 is oculomotor, 4 is trochlear, 5 is trigeminal, 6 is abducens, 7 is facial, 8 is vestibulocochlear, 9 is glossopharyngeal, 10 is vagus, 11 is accessory, and 12 is hypoglossal. Okay, now I'm going to assess your neurological system. Could you stand up for me? I'm going to do the Romberg test. So just close your eyes and put your arms out. Okay, no swaying. You can sit down now. Now I'm going to test your sensations. So just tell me if the touch is soft, dull, or sharp. Close your eyes.
Short. Dull. Soft.
Okay, good. Now I'm going to do graphesthesia, and you're just going to tell me what I draw on your hand with your eyes closed.
An A. An 8.
All right. Now I'm going to test your patellar reflex. Okay. Now I'm going to check for meningitis. If you could just lay down for me. I'm going to be performing the Brudinsky, so just lift your head to your chest. Okay, no signs of meningitis.